Hey y'all, it is Dr. K-Mac. I am a licensed clinical psychologist, and throughout the month of January, I have been bringing you all small, manageable tips to help you maintain your mental health and wellness. And we are down to the final tip, and this one is about therapy. So it may not feel like a small tip to some of you. It may feel very big. It is a commitment, but I do want to talk about the importance of therapy for people where it may be a good fit, particularly when you're dealing with certain mental health symptoms, emotions, challenges, etc. So, first, I want to start off by saying I recognize, even as a psychologist, that therapy is not for everyone. I also recognize that there are different barriers and obstacles to people receiving not just therapy, but a place where it feels a provider who feels safe, where it's good quality care. Telehealth services have helped a lot with that. There are places to make it more affordable. And so there are some concerns as it relates to therapy, but I do want to point out that sometimes therapy may be the thing that you need. Okay, so let's jump into it. Sometimes you might find yourself repeating the same patterns, and no matter what you do, you keep finding yourself stuck in this loop. For some people, it may be that those emotions, like we've gone through a month of these small steps that you can take to maintain your mental health and wellness, but you're finding that nothing is helping. I'm doing all the things, but I'm still depressed. I'm still having a difficult time getting out of the bed in the morning. Or the trauma is so debilitating that it's hard to go outside of my house. It's hard to connect with other people. It's hard to go out into the world. For some people, it may be that, I'm trying these relaxation strategies. I'm trying things to reconnect my mind and body. But what I'm finding is that the anxiety is just overpowering me. It is consuming. It is something that is affecting me day in and day out. If you're experiencing that, therapy may be an option that you hope to, or you should explore, or you could explore. Oftentimes I think about, at different points we may all experience different symptoms, but when you notice that it's starting to affect your functioning, and I'm talking about in different areas. So it's affecting your sleep, your appetite, it's affecting your activity levels or what you might be doing, your connection and what you may do with other people. You may be noticing at work, like it's hard to maintain your concentration or focus, or you're not getting your tasks done. For students in school, it could feel like I'm studying and I'm doing all of this work, but I'm not retaining the information. And so you're really starting to notice that this thing that you're dealing with is sort of like spreading out, and there's this ripple effect in your life. Therapy can help with that. And I want us to think about therapy as an option because stigma will keep us from going to therapy. Stigma will make us believe that I need to pray harder, or, I should feel more appreciative of the life I have, or I have to get through this. And I'm here to tell you that finding the right provider, finding the right fit could be exactly what you need. And I know you all have probably heard this 1,000 times, but we think about other areas of our life where we don't even question, should I see a provider? Oh, my tooth is hurting. I'm calling the dentist. I'm calling the dentist ASAP because I don't want to deal with that pain. When we think about high blood pressure, we think about things such as diabetes. We think about even people who, and this is no shade, but people who are willing to go to the doctor to get weight loss drugs. It's like, okay, I've been struggling with this weight, with losing weight. I want to seek a doctor. You want to think about your mental health in the same way. So therapy, one, gives you an outlet that should feel like a safe place. You are working with a licensed provider. If your provider is not licensed, remember that is something that they have to disclose to you, and they should be under the supervision of a licensed provider. It gives you a place to sort of talk through what it is that you're experiencing, to identify how it's impacting your life, to start to think about what are those goals or those outcomes that you want as a result of therapy. And then that provider is a collaborator with you. They may be an expert in their field, but they are not an expert on you. So they are really collaborating and partnering with you, using their expertise to guide the process of helping you manage, cope, and heal. I tell people all the time, I do healing work, but the healing is on you. I'm going to be here and help guide you. We'll talk about strategies. We'll talk about how do you manage things as they come up. Sometimes therapy can help you sort of like get through all the, I think of anxiety sometimes can feel very chaotic because it's a lot of what ifs, what if this happens, what if that happens, and all of the things. Sometimes therapy can help like silence some of that so you can see clearly to figure out what you do need for yourself. For many people, they start to learn their patterns. Oh, here are the patterns. This is where I start to make those decisions and choices that don't align with how I want to feel. For some people, they start to be aware of their own symptoms. Okay, when I'm in these situations, I'm more likely to respond in this way or to feel this way or to think this way. So here is what I can do. And you really learn to disrupt cycles that may or may not be best for you. Lastly, for some people, especially when you're thinking about severe mental illness as well, there may need to be conversations around, are there medications that may help to also manage your symptoms? And so for a lot of people, I will recommend talking to a provider. You can do a consultation. And if you have that consultation and you feel like, no, that still isn't right for me, at least you sought the information out. The other thing that you can think about is the best combination, or like when we think about what are those effective combinations for treatment for those who may need medication to help manage your symptoms. One, you do want to trust that person. You want to be clear on the medication you're taking. You want to be clear on the side effects that you may anticipate, and you want to be clear on what you can expect to see and when you can expect to see it. Okay. Given all of that, even if you're getting medication, for some people, that best combination will be, working with a prescriber while also being in therapy. Because the medication, sometimes I think of it as like helping to quiet some of the thoughts so you can better access what you're getting in therapy. Okay, that's a very brief overview. But I did want to close the month with that idea of sometimes therapy is a part of the process. And so if you have questions about therapy, things you're still wondering about, send me a message. People don't want to put it in the comments, and I totally understand because mental health is private. It is your personal journey, but you can always reach out to me in the comments. I am not providing clinical services. What I will do is direct you to the information that may be most helpful for you. Okay, y'all, let me know what you think.